Hello, and welcome to the JCO Precision Oncology Article Insights. I'm your host Jiasen He, and today we'll be discussing the JCO Precision Oncology article, Longitudinal Evaluation of Circulating Tumor DNA as a Prognostic Biomarker to Detect Molecular Residual Disease in Germ Cell Tumors, by Dr. Rebecca Hassoun and colleagues. Traditionally, treatment response for solid tumor has relied on imaging, which focuses on visible anatomic changes in the tumor. However, imaging does not always reflect molecular or cellular changes and cannot detect microscopic disease, which is clinically important and often linked to relapse. Liquid biopsy, on the other hand, is minimally invasive and can be used for cancer monitoring by analyzing circulating biomarkers in biofluids such as blood. One type of liquid biopsy is circulating tumor DNA, ctDNA, which measures small fragments of DNA released by tumor cells into the bloodstream. ctDNA can allow precise monitoring of tumor-specific mutations and be a powerful tool for assessing treatment responses. ctDNA has already been applied in clinical settings for cancers such as non-small cell lung cancer and breast cancer, etc. However, there is still limited data on the use of ctDNA for germ cell tumors. Germ cell tumors are the most common malignancy affecting men aged 15 to 35 years. Accurate risk stratification and disease monitoring is key to risk-adapt therapy, maximizing the chance of cure while minimizing side effects. One unique tool we use currently for diagnosis, staging, and monitoring is serum tumor markers such as AFP, beta-HCG, and LDH. However, these markers have limitations, including forced elevation in certain clinical scenarios. And the study have shown that they can be normal in up to 40% of patients with germ cell tumor. This creates an unmet need for other sensitive and specific biomarkers to improve patient care. In this paper, the authors investigated the use of ctDNA in a cohort of patients with germ cell tumor at various disease time points. They compare ctDNA results with traditional serum tumor markers to evaluate whether ctDNA can predict relapse and survival outcomes. This multiple institution retrospective study includes patients with stage 1, 2, and 3 germ cell tumors, primarily testicular cancer, who had at least one ctDNA test result. ctDNA was evaluated longitudinally at different time points, including pre-archiectomy during the minimal residual disease (MRD) window, defined as 1 to 12 weeks post-archiectomy but before primary therapy, and during the surveillance window, defined as more than 12 weeks post-archiectomy or follow retroperitoneal lymph node dissection or post-chemotherapy. ctDNA analysis was performed using a tumor-informed 16-multiplex PCR next-generation sequencing assay. A total of 324 plasma samples were analyzed from 74 patients in this cohort. The majority had stage 1 disease, around 40%, and non-seminomatous histology, around 70%. 15 patients were evaluated in the pre-archiectomy window, and only one patient tested negative for ctDNA. This patient had stage 1 disease. The authors further assessed ctDNA positivity in both the MRD window and the surveillance window, evaluating its association with event-free survival. They found that ctDNA outperformed serum tumor markers in both settings. ctDNA positivity was associated with significant worse event-free survival compared with ctDNA negative patients. Among the 14 patients with stage 2 to 3 disease who had ctDNA assessed in both the MRD window and the surveillance window, 9 patients consistently had a negative ctDNA or converted from positive to negative over time. In contrast, 5 patients demonstrated persistent ctDNA positivity, and all of these patients subsequently relapsed. Among the 38 patients who had both ctDNA and the serum tumor markers tested during the MRD window, 9 patients showed discordant biomarker results. Of these, 6 patients were ctDNA negative but serum tumor marker positive, and 1 of them experienced recurrence. 3 patients were ctDNA positive but serum tumor marker negative, and one of these patients also recurred. During the surveillance window, 46 patients had both biomarkers available and 10 showed discordant result. 3 patients were ctDNA negative but serum tumor marker positive, and none of them recurred. In contrast, all 7 patients who were ctDNA positive, serum tumor marker negative, experienced recurrence. This intriguing data strongly support the potential role of ctDNA in patients with stage 1, 2, and 3 germ cell tumors. However, as the authors noted, the retrospective nature of the study presents limitations, as treatment approaches, imaging schedules, and the timing of testing were not standardized, and the ctDNA testing varies among participating institutions. Larger prospective trials with standardized protocol and long-term follow-up will be essential to validate this finding and determine how ctDNA can be reliably integrated into clinical practice. Thank you for tuning into JCO Precision Oncology Article Insight. Don't forget to subscribe and join us next time as we explore more groundbreaking research shaping the future of oncology.
The purpose of this podcast is to educate and to inform. This is not a substitute for professional medical care and is not intended for use in the diagnosis or treatment of individual conditions. Guests on this podcast express their own opinions, experience, and conclusions. Guest statements on the podcast do not express the opinions of ASCO. The mention of any product, service, organization, activity, or therapy should not be construed as an ASCO endorsement.